Thank you very much, and good afternoon. I want to start by acknowledging today that the world is a little bit more uncertain, and for some people that can be provoking anxiety and fear, and particularly with what we are seeing in the Ukraine. And of course, this is on top of what we have experienced for this past 2 years with the COVID pandemic and the number of climate disasters that we have been through here in BC. And I know that this weighs on us, and especially on children. And I want to remind people there is help. I want to remind people about the Kids Helpline, in particular, 1-800-668-6868, or you can text 686868 and reach out and talk to somebody. These are times when we need to connect with each other and support each other, and especially for our children. Having said that, we are seeing some very encouraging trends that set us in many parts of our province. The transmission of COVID is down, which in turn is relieving the intense pressure that we have had on our hospitals and on the broader healthcare system. At the same time, there are still many, many areas that have significant transmission, and we are still seeing widespread transmission of this virus across the province, which is why those protections we have in place right now remain a necessary part of our strategy for now. As we move into March, today being March 1st, we have committed to monitoring these, to making sure that we can make the changes that are needed based on our best data and our pandemic. And we've talked about the importance of doing this prior to spring break, and that is something we have committed to, and we'll be looking at additional precautions and what if we're in a better place to be able to remove some of additional measures very soon. This morning I had the opportunity to spend some time with immunizers across BC and across parts of Western Canada in the BC Immunization Forum. And it was really an opportunity to reflect on the incredible work of so many people that have gotten us to this point in the pandemic. We've delivered over 11 million doses of vaccines in every corner of British Columbia. And people, immunizers from all walks of life, have been stepping up and doing a tremendous job. And I just want to express my gratitude for the heroic work that they've done across the province and continue to do to support people in making those important decisions. And I want to thank British Columbians for stepping up and getting vaccinated. Some of our newest tools are new types of vaccines, the protein subunit vaccines, Novavax, which we talked a little bit about last week, and a number of questions have come in, so I just want to talk about a number of them. The Novavax vaccine is approved for use for people 18 and above. It has not yet been tested in younger children. It is safe to mix and match, so if you've had an mRNA vaccine or a viral vector vaccine as your first dose, and you've had concerns or side effects from that, you can use this as a dose too. You don't need to start again. So Novavax can be your second dose in the primary series, and it should be at about 8 weeks. It can also be used as a booster dose if you've had 2 doses of any other vaccine. So it is safe to mix and match. There is no need to start again. And for those people who have not yet started your course of vaccination, Novavax is a perfect opportunity for you to rethink that and get the protection that others have. So if anybody is interested in Novavax, you can call 1-833-838-2323 and put yourself on the list. And I know we have close to 1,000 people at least already on that list. And as soon as it comes into the province in the next few days, we'll be making arrangements for you to get your dose. In addition, last week, Health Canada approved the Medicago vaccine, which is a really interesting plant-based vaccine. It uses what we call a virus-like particle that is developed in plants. And again, it provides the entire protein to your immune system. So it's different from the mRNA vaccines, where you get the code for developing that protein. And it is packaged with a similar adjuvant to what we used for the H1N1 influenza vaccine, and it's a similar type of vaccine to the ones we have for HPV and hepatitis. So it is a more one that we're more used to. I will say that it is only approved for use for people 18 to 64. They didn't have a number of older people in the trials. So right now, there's no reason to believe it's not effective in older people, but the data is not there. So it is for people 18 to 64 years of age. Unfortunately, though, we're not expected to receive any of this vaccine in the province or the country for the next few months. I will say vaccination is our key. It's the key that we have had for getting through this past two waves, both Delta and Omicron. It's made a tremendous difference in reducing transmission, and we see that particularly with the booster dose. And yes, the booster dose is effective at preventing you from getting infected with Omicron. We've seen that. It's 60 to 70%. Data from Quebec shows that it's 80% protective on preventing you from needing to go to an emergency department, and we know that it's highly protective at preventing hospitalizations or ICU care. So I am encouraging everybody who has not yet had it to get your booster dose. It will help you now, and it will help you for what we will be dealing with in the future. And I will remind people that in hospital right now, thankfully, we have decreased numbers of people, but 47% of the people in our ICUs are people who don't have that protection that vaccines have been giving us, and that comes from about 8% of the population. You are much, much more likely to get severe illness if you don't have the protection, if you don't have your immune system stimulated by vaccination to recognize this virus when you're exposed to it. And it's still about 20 times more likely that you're going to have a more severe illness. And I know people have sent me notes about the fact that there's more people by numbers in hospital who have had vaccines, but that is because so many of us are now protected through vaccination. And some people, yes, are at most more risked, but your risk is still that much greater if you don't have that protection from your immune system that vaccination gives. And I liken it to the analogy of we all know people who've smoked for long periods of time, and not everybody develops lung cancer, but your risk of smoking and developing lung cancer is much, much higher than a non-smoker. Very similar to what we're seeing with vaccination. As has been the case throughout the pandemic, we all have a role to play, and we need to make decisions based on our personal risk and the risk of those around us. The responsibility of us in public health is to give you the tools and resources to be able to manage and to understand that risk. And as we've seen, as we've gone through this period, we've come to understand a lot more. We know that the most important tool remains protection through immunization, but we also now have more access to things like tests that help you make those decisions about your own health if you develop symptoms. Looking ahead, as we expect transmission to continue to decrease and the weather gets warmer and we get into spring, we spend more time outside, we will likely no longer need those extra layers of protection that we've had in place during this peak of transmission during the last few weeks. Of course, this is not the case for everyone. We know that some people who are immune compromised, people who are older, will need to continue to take a cautious approach. And this is where, again, we need to work together to do what is right for us and to respect that other people have different risk. And that understanding that masking is important for people. Everybody right now, but it will continue to be important for a number of people. Keeping that respectful distance, knowing that not everybody will be moving at the same pace. Keeping groups small will remain important for many people. As we are getting close to spring, we know that respiratory season tends to wane, but we know as well that it tends to increase as the winter months come again. So continued uncertainty as we move through the summer. We hopefully will be in a good place for the next few months because of the immunity that we have and where we are to be able to relieve the pressure that some of these measures are in place. But we need to be prepared for immunity to wane again and for us to have new approaches and adapt depending on what we see come the fall. We have all experienced the impacts of this pandemic, and without a doubt, it has been difficult. That is why we will be removing restrictions and layers of protection as soon as we are confident we can safely make those changes, and we can support everybody in doing that. We are being cautious. We have heard loud and clear that we need to be thoughtful and move cautiously and slowly, because that is the way that we will continue to gain ground and not lose it. Each step of the way, we will make the decisions based on what we're seeing, on the data that we're seeing here in our pandemic. At the same time, I am very optimistic that we are moving to a better place rapidly, and we'll have more to say about that very soon. I know things like graduations and performances and concerts and many workplaces are now moving to full in-person return to work, if that hasn't occurred already. We are in a transition period, but we will take it slowly and sustainably as we move into the next little part. This pandemic has also shown us the importance of connection, even virtual connection. And now more than ever, we need to continue to support ourselves, to make sure that we reach out and connect with those in our life right now, people we may not have connected to build those bridges as we move into this transition phase, and to make sure that we continue to support each other with compassion and with love. It is important to know that the things that we do make a difference to everyone in our world, whether we're doing it for those we love and for those we don't know. It is important for us to now, with all of the uncertainty that we're facing, to reach out and connect and support each other as we've been through this storm together. Thank you.
Thank you, Dr. Henry. And today I'm providing an update on rapid test deployment and surgical renewal. But first, I wanted to give a brief update on the impact of sickness on healthcare workers and the healthcare systems. Health authorities continue to closely monitor sickness levels across health services, especially in hospitals, long-term care, and home support. I can report that from February 21st to February 27th, 13,631 healthcare workers called in sick. That includes 3,121 in the Fraser Health Authority, 2,517 in Interior Health, 1,299 in Northern Health, 1,293 in the Provincial Health Services Authority. That includes BC Emergency Health Services, our ambulance paramedics, 2,137 in Vancouver Coastal Health, 2,679 in Island Health, and 585 in Providence Healthcare. Just to put that in context, February 21st to 27th, that's 13,631. Last week, February 14th to 20th, 14,579. February 7th to 13th, 15,542. January 31st to February 6th, 17,158. Each week, the number is lower, although it's still above what we would normally expect at this time of year, but it shows the same thing as other indicators that Dr. Henry has referred to, the fact that hospitalizations are half of what they were, less than half of what they were at the peak of the Omicron variant of concern wave. Once again, I want to express gratitude to healthcare workers who continue to lead us through the pandemic for their endurance and their skills. Today is BC Care Providers Day, and healthcare workers, particularly in long-term care and assisted living, are being celebrated today. I encourage everyone to find a way to celebrate those healthcare workers, members of the Hospital Employees Union, the Health Sciences Association, the BCNU, the BCGEU, the Doctors of BC, the Union of Food, the UFCW, Union of Food and Commercial Workers, and others who are significant players in the healthcare system, and all those operating and running our long-term care and assisted living facilities across BC. And now an update on rapid tests. As of February 28th, BC has received 24,056,910 rapid tests. We continue to prepare for the arrival of 12 million tests over the next 4 weeks at a rate of 3 million per week. 17,525,751 have been deployed to key strategic areas. As previously noted, just over 500,000 tests in our inventory are not suitable for deployment or personal use and are being used at the discretion of medical health officers in the appropriate setting. They need a health professional to do the tests. That leaves a current inventory of 5,974,000 tests suitable for self-administered use across the province. To date, 3.3 million tests have been distributed to K-12 schools across the province. 2.1 million tests have been distributed to post-secondary institutions, already distributed. 2.5 million tests have been delivered to more than 900 pharmacies, with more pharmacies receiving deliveries soon. An additional 600,000 tests will be sent to pharmacies this week. As announced those week, these tests are for British Columbians aged 70 and older to pick up a kit containing 5 tests at participating pharmacies. This age group is a priority, as we've said many times, because the evidence indicates they are at more risk of serious consequences if they become infected. If they become symptomatic, the test will allow them to determine if they may have COVID-19, so that other actions can be taken as required. As of yesterday afternoon, end of day, pharmacies have delivered approximately 366,000 tests. That's more than 70,000 seniors 70 and above have received their tests. For more information on accessing test kits, British Columbians can visit bcpharmacy.ca to get the location in their community. It's important to remember that testing continues to be something that we do when we have symptoms. That hasn't changed. Increased test availability means more members of the general population will be able to access tests to use to understand their own symptoms and illness and to take actions to limit transmission to their friends, family, and work, including and especially those at higher risk. And now finally, here's our weekly surgical renewal update. Health authorities report that 6,428 surgeries were completed from January 30th to February 5th. From February 20th to February 26th, our most recent week, health authorities postponed 99 non-urgent scheduled surgeries. That's 2 in Fraser Health, 92 in Interior Health, 1 in Vancouver Coastal Health, 2 in Northern Health, 2 in the Provincial Health Services Authority. Cumulatively, from September 5th, 2021 to February 26th, 2022, regional surges of COVID and factors including severe weather patterns have caused 8,025 surgical postponements. For several weeks now, with hospitalizations due to COVID high and with a great many patients with COVID in our ICUs, we've talked about our role in bringing those numbers down. We've said our work together makes the difference that matters. And here's how. This week, all health authorities, that's Fraser Health, Interior Health, Northern Health, Vancouver Coastal Health, Vancouver Island Health, and the Provincial Health Services Authority, all our health authorities began scheduling and completing postponed surgeries, all of them. We've also talked about how each moment matters, as does the difference we make in it. And the difference we've made to patients who wish to proceed with their postponed surgeries by stopping COVID's rapid spread and easing the stress on our hospitals is just as impressive. And here's why. Because 99.8% of patients whose surgeries were postponed in the first wave have had their surgeries. Because 94.2% of patients whose surgery was postponed in waves 2 and 3 have had their surgeries. And because 49.2% of patients whose surgeries were postponed in waves 4 and 5 have now had their surgeries as well. I think it's worthy of pause by all of us to think how welcome this news is for patients across BC, for the families and friends supportive of them, their care and their well-being, and how much it says about everyone involved in delivering surgeries. And in that, it reminds us our work is not done. These achievements demonstrate again all that is possible of the progress that is ours to make. And here's what I think we need to do now. Take care. As restrictions ease, as we've all been out and about more, we need to take care. Ease into activities we haven't done for a while and make sure we're ready for the change, the demands it places on us, and the attention it requires of us. Take care of, think of all of those who deliver our care, make our surgeries possible. Take care and support residents in long-term care and keep our hospitals doing all the remarkable things that they do. Take care of ourselves and each other to ease the workload on them whenever we can. That's the work we need to do now.